Hello, everybody. Welcome to this new Friday. Happy Friday, everybody. And I am back. I know we still have 3 or 4 minutes to go. All the system is working, looks like it. So, so those who are with me here, let me test if you are able to see me or not. If you're able to see me, then we are good to go. Okay, perfect. So today we are going to talk about very, very important question here. And the important question is, the original question was why startup ideas fail in healthcare. Why do they fail? And it's a simple question. It's a simple question, but the answer is very long. And today I'm going to talk about one part of that question. And that one part has to do to understand what are the different type of healthcare innovations exist. How many different type of healthcare innovations exist? That is the main question. As a startup founder, if you are able to identify in what category my healthcare idea, my healthcare innovation exist or fall, I would be able to make a better justice with my idea and take better decision in order to make it more successful. So what are the three different type of innovations? Basically three, one, two, and three different type of healthcare innovations. Very important, the first one. We'll talk about the first one. Very important. The first one is focused on consumers. The first one is focused on a consumer. It is called consumer focused ventures. Consumer focused ventures, now you have to understand it, what it means. Consumer focused ventures are, and I'm going to show you the another one if you can hear me here. So these are the three distinctly different type of healthcare innovations. So why we call them a distinctly different type of innovations? We call them distinctly because when you put your healthcare plan in action, they look very different, but sometimes they overlap. So when we talk about consumer-based venture, I'll give you an amazing example, and you would be thrilled to listen that example. So those who are still joining us, I'm going to keep it going until we start at 12 because I started this show early because I wanted to test it. But before that, um, I do this show every Friday at 12. All of my shows, if you happen to participate, believe me, I'm not going to do any dances and any crazy stuff here. That's separate. But if you are serious about some good education for healthcare startup and good ideas, how to make your idea happen, then do attend these sessions. It's absolutely free every Friday, 12 a.m. It's for everybody, whoever wants to join, whoever has a passion for startup, and especially in healthcare startup. This education came from my last 20 years of my experience. So it's a very, very important, my experience, what I'm sharing here. And it is structured so well that we will take one topic every session. So every Friday, I'll talk about only one topic, and that topic would be basically uh, talking about that topic will take care of the one of the factors which makes your healthcare startup successful. So today we are talking about three distinctly different type of healthcare innovations. What are those? The first one, consumer based. So if your idea is purely focused on a consumer, and I'll give you an idea what that means is when I say that, what that means is, so when it is purely based on consumers, so sometimes, reducing the time the patient spends waiting, coordinating, traveling, um, or reducing the cost of care for patients, or making their life much easier by adopting their technology. So basically, the cost of healthcare has to go down, and the innovation, you have to make it so that healthcare become both better and cheaper. So we have to distinguish among these innovations so that we can find the different purposes they have and how they can align in different ways together. So this first type of innovation involves consumers in new ways so they get better health care quality and control and its cost. So it's an internet age. Today's internet age. Everybody talks about, they can Google it, search it, talk about where to go for their next, So if somebody is trying to find the better cost of surgery, they go online and they search different vendors or different doctors, different surgery centers, and they can easily find out how much it is going to cost it in order to get the service. So these consumer-focused ventures are the tools and technology which enables a consumer to be the king. So consumer is in the focus. I'll give you an amazing example, which talks about the TV. Now, what does TV has to do with reducing the cost, right? So think about it. In Toronto, this is a real story. In Toronto, there is a hospital called Shoal Hospital. And what they do is they do mostly perform hernia surgeries. And this is a perfect example of a consumer-focused venture. So they have been debating about this for a long time, how we can reduce the stay for our post-surgical patients, because if they stay for more than 7 days or 5 days, the cost of healing and cost of post-care of surgery becomes very high. So how they can reduce it? So think about it, where somebody came up with an idea. They said, what do we need in order for them to heal faster? So he said they can only heal faster uh, if they do some kind of physical walk, or they do a little bit more during the post surgical care. So somebody came up with a fantastic idea that let's remove the TV from their own rooms. Think about it. Removing the TV from their own room, just a simple idea. And what it does is it allows patients and it motivates them to go and walk to the dining hall in order to have their dinner, watch TV, and then come back. So anytime somebody has to watch TV, they have to start walking from their own post-surgical room or recovery care and go there. The more they walk, the better they become. And that one idea has reduced or shortened the stay for a patient from 7 days to 5 days. Think about it. And that is innovation. That is where the consumer is directly getting impacted right there. And you won't believe, they had an end of a year annual celebration, over 1,500 patients that paid for their own flight tickets. They came and they celebrated that annual function with that hospital because they were so excited about sharing this post-care surgical results. They were fantastic. So results were very good, and people got better. So that's the one thing. Another example I'll give you how the consumer-based focus venture for healthcare innovation is working in action in today's scenario, globally, not here, with the help of Patient Portal, or if you have heard about, you know, people used to wait a lot. The average waiting time in United States for patients is about 21 minutes to an hour when they go and see a doctor. So with the help of Patient Portal, what happens, they don't need to wait. They can in advance send all the paperwork online to the doctor's office. So in order to show up in an hour in advance in any doctor's office, whenever you have an appointment, you can send your paperwork in advance using the EMR or Patient Portal link. You get a text. So if you have an appointment at 12:30, you can actually reach at 12:25, because, and I have done it for myself, because all the paperwork is already there electronically. All you have to do is just show up at 12:26 and then go and see the doctor. Now there's another problem which has not been solved, that if the doctor is backlogged, so if doctor is behind, but due to this, I think doctors are going to be more and more efficient, and this problem is going to be solved very soon. So those are the innovations and examples I have given you when we talk about the consumer base. So here is a homework for you. If you're listening this now, if not now, later, do this exercise for yourself. Find out in what category your healthcare innovation or idea falls. Are you impacting the consumer? If so, it is a consumer based idea, no matter whether you use technology for that, whether you use any kind of different ideas. But as long as the impact is directly on the consumer, then it is a consumer based venture. Okay, let's talk about the second one. Second one is called technology based ventures. What does that mean? It doesn't mean that if you come up with a software, I know everybody talks about the software and hardware or some kind of computer technology, it automatically becomes a technology based. No. What it means is, if you see in the consumer based ventures, we have seen people using technology there as well, like patient portals, different things. But in technology based venture is where your idea is primarily revolve around a unique technology which will solve the problem. Implants, diagnostic services, drugs, MRI, x rays, gene therapy, all of those are the great example for technology based. Now, there was a cathedral which is antibiotic, which solves the problem and reduce the infection rate amongst the surgical patients. EMR, it's a technology, different technologies, different EMR, but same EMR can fall into a technology based venture as well as a consumer based venture, because ultimately it is impacting a consumer and it is also in technology. That's why we call them a distantly different, because they are different, but at some point the same innovation can overlap. So when we talk about an implant, it's a technology, and most of the best distinguisher is, if you go and see most technology based ventures, they apply for IP. So there's a process, there is an IP, it's a unique um, tool or technology which drives the innovation in healthcare. So that is the main differentiator between a consumer based and the technology based, that the technology is driving the innovation. If there is no technology, no innovation. So when I gave you the example of the patient portal, there are various ways you can have a patient portal, but the thing which drives the patient portal is the technology behind it. So the patient portal is impacting a consumer, so it is a consumer based, but also it has a technology inbuilt into it. And if there is no technology, that consumer experience is not going to be achieved. So it is both. So sometimes you have to see in what category your idea falls into. So technology based and consumer based. How are we doing so far? Are we doing great? Okay, fantastic. So the third one, which I'm going to talk about, is called integrators. Now, what do you mean by integrators? Integrators are those who create um, innovations by integrating two or three different type of um, different uh, uh, features. Like, I'll give you an example and you would understand it. It's basically, integrators are the ones which are creating um, so they bring the consolidation, efficiency, standardization to the healthcare system. So these ventures are, they bring a group efforts, benefit of consolidation. So like they often feature technology and especially information components. So um, just an example. I mean, healthcare is highly fragmented. So let's say about 15,000 nursing homes operate in a small group. Um, HCI, hospital group, they have hundreds of hospitals together. Or a billing company, a billing company is a great integrator between a software and a medical hospital, or whoever they are producing, whoever they are serving, so doctor's office. So integrators are basically a group of innovations. They come together, they form a group, of they impact larger masses in a group setting. So HCA has over 150 hospitals in one chain. So that they are integrators. Or there was a company called Cario. They acquired another company, Dr. Base, because Dr. Base was technology and Cario is more consumer faced, and they both become an integrator and they become an integration innovation. You see a lot of mergers and acquisitions happening in different domains. So, like if there is an institutional venture capital based funded group, and if they are acquiring a hospital, or if they are acquiring a doctor's office, which is happening a lot these days, they are called integrators. So integrators is basically a group which brings consolidation, which brings efficiency, which brings similar type of innovations together, but they integrate them well under the one umbrella. So if you have heard about Blue Cross Blue Shield acquiring medical practices, they acquired one here in Tampa Bay Diagnostic Clinic. Why they are doing it? Because they are integrators. So they fall into the integration innovation. So with this, I'm going to give you some more example, but let me see. I have one great example about text to patient, which is happening across the board right now. If you go to the doctor's office, you receive a text, you have a scheduled appointment on such and such date, you get another reminder. I know you get annoyed sometimes, but this is a great example of a consumer based service. Referral service. Earlier, when you go to the doctor's office, you used to print a referral. Somebody needs to call the specialist office, make sure your appointment is set up with them. Right now, it's all happening through the technology. So it's very important for you as a startup founder, if you're listening this and you're a startup founder, to understand in what category your innovation fall under. If you are able to identify the problem well, you have a solution which you came up because of your own idea. But at the same time, if you are able to find what category and what type of healthcare innovation you have, you would be able to, this would be the third step, and you would be able to make some progress. In our next session, I'm going to talk about a different thing, how you can make that happen. So today we talk about the three distinctly different type of healthcare innovation. Send me a message if you need to know something else. You are seeing me on YouTube, you are seeing me on Facebook, and you are also seeing me on LinkedIn Live. I hope so. If you have any question, feel free to send me a message here later. I am here to respond and reply whatever I can do. But thank you very much for attending my session, or you will be watching it later. So thank you again, and have a great day, an amazing Friday afternoon.